All right, so let's get started. Wilson, next slide, please. Lake County Workforce Development is part of the Job Center of Lake County, and our offices are located at the corner of Genesee and Washington Streets on the first floor of CLC's Lakeshore campus. We are currently open by appointment only. You can see a picture of our building on the screen. Next slide, please. Here's our social media information. If you need to get a hold of a Workforce Development or the Job Center, you can do it through any of these social media outlets. On YouTube, we do have some videos of our services, so please feel free to visit. If you do go to our website, you will see different tabs for things like signing up for free tuition dollars. Next slide, please. Under our virtual information session and our monthly calendar. Here on the screen, we have highlighted a few items from our calendar. Need help with your resume or mastering virtual interviews? We have workshops this month that we can help you with. Next Wednesday, we have a virtual event for cybersecurity. So if you know someone, a family, a friend, a community organization that could benefit from these programs, please share our info. All right, thanks again everyone for showing up today. I appreciate it. The health department appreciates it. And without further ado, let me introduce you to Lorraine Harris. She's the HR director for Lake County Health Department. Thank you.
Good afternoon, everyone. Welcome and thank you for joining our hiring event for our behavioral health positions here at the Lake County Health Department. It's always a pleasure partnering with Workforce Development and hearing about all of their services that they provide to Lake County. Please make sure you take advantage of them, go on their website and check them out. It's great information. So we will get started with the next slide with the Health Department history. Who are we? Well, the Health Department, we are very proud to be among the top 6% of 2,864 local health departments nationwide. And that's based on population, service, finances, and workforce. So we were established in 1956 by referendum, and that's basically to address pervasive health issues within Lake County. And then in 1970, we acquired the primary care and behavioral health services for the underserved. And then in 1995, it became a federally qualified health center, which referred to as FQHC. And so that is also primary care services for the underserved. We receive grant money for that. So of course, there's criteria that we need to make sure we follow and have a governing council board and as well as sliding fee. No one's turned away for their inability to pay. So we are proud to be a public health accredited board, a state certified public health department, and a joint commission accredited community health center. So all those accreditations basically mean that we must continuously improve in all of our services and make sure we're maintaining quality performance to our community members. So it's great to have all the accreditations, but we get audited and we're always looking for, how can we better improve our services? So next slide. Our overall goal is to achieve the highest level of health for Lake County. And to accomplish this mission of promoting the health and well-being of all who live, work, and play in Lake County, we work closely with community partners and to address social, economic, and environmental causes of health inequities. Next. If we can improve the health of Lake County residents, then our vision of healthy choices, healthier people, healthiest communities will become reality. Next. Our employees are committed to carrying out the mission of the health department and providing services that adhere to the following values. Customer service, we provide service to ensure an approachable, compassionate, respectful, and timely manner to all of our customers, patients, clients throughout the community, whether it's answering phones, people that come in and visit, people we serve. Teamwork, we work together to support our team to get the job done in a culturally sensitive manner. It really has come to light over this past year with our pandemic to just see how many people has stepped forward within our staff they're moving in directions they've never moved before. They're working in positions they've never worked in before. I contact them, ask for volunteers, and they're ready to volunteer, whether it's in the mass vaccination clinic, whether it's a year ago when we were continuing taking incoming calls. We may receive about 1,400 calls in a day from community members. Although there's information out there in social media, on the website, we still address the phone calls that are coming in. So we can't do this alone. There's no I in anything that we do here at the health department. We have to work together as a team, whether it's with partners, whether it's with our boards, whether it's with programs and other departments. We have to work together in a culturally sensitive manner. Professional competence. We're seeking highly skilled and trained workforce that brings positive results to our agency and to our community. So that's why we're here today as well, looking for the next level of top talent that we can bring to our agency to help us to accomplish our strategic goals, to help us to accomplish all the goals of the agency. Fiscal responsibility, basically, you're being ethical and wisely managing resources and making sure that our resources are our money, time, and materials, so we don't end up in the news. So next, okay. Next slide. One agency. So our leadership team, in conjunction with two of our boards, I mentioned the Board of Health, Lake County Board of Health, and the Governing Council. Our Governing Council is comprised of 60% of our patients and community members in our board, and there's 10 members, and then our Board of Health has 12 members. And so they meet monthly and addressing, ensuring that we are staying in line with our mission, vision, and values, and that we're clearly articulating our role in improving health for Lake County residents. So as you see here, this is listing all of the service kind of departments, services that we have. Each of these have a director that leads them, and then they have associate directors and leadership team under them, and then all the staff. Mike and Nick will talk about behavioral health services, but just briefly, I'm not going to name all the programs because we have about 60 programs, but business ops would entail human resources, and maintenance, purchasing. Environmental health would entail like beach and sampling, water well inspections, restaurant inspections. Our finance, of course, is billing and accounts payable. Healthcare operations would be like a call center. Health informatics would be our IT department. And then physical health, primary care, that's our community health centers that I mentioned earlier. Prevention has our tuberculosis clinic, family case management, communicable diseases. So we have about 903 employees, and we have an operating budget of about $85.3 million. So next slide. And then this just is a map that where we're located. We're all over the place. We're in Zion, North Chicago, Highland Park, Round Lake. And so this is just a map of everywhere we're listed. So you will get a copy of the slide. So we have 17 locations. We're spread out. Many people are not aware that we have this many different locations. So this is a really interesting slide. Next. And then we offer a competitive salary and benefit package, flexible work hours, and comprehensive wellness and training program. As you can see on the slide, our benefits are Blue Cross Blue Shield. There are options available for part-time employees at higher rate than full-time employees. The flexible spending account, health savings account. Flexible spending account, you basically have to use that by the end of the year. Then a health savings account that keeps going on. So that's basically putting some money aside where you can use for tax-free, so you can be able to use for medical options that you have. And our retirement plan is through Illinois Municipal Retirement Fund. If you're working over 912 hours, 1,000 hours a year, then you will automatically have the 4.5% taken out of your paycheck. You have to complete the forms and everything. But then you can also have another up to 10% taken out to save for retirement as well. We have pet insurance, then we have a wellness program through Lake County, but then also the health department, we have an Inclusion and Diversity Council, a Green Team, and HealthWorks, which is our health type of committee, but there's a lot of different other work groups within the departments. You may hear about some of those today from our panelists. So we'll move off of this slide. Next. Okay, so at this time, we are going to really want to spend time on the panelists, because that's why you're all here. So we have a lot of questions for them. I will have them start off by introducing themselves. If you can take yourselves off mute, you will introduce yourselves. And then if you can share what your role is in the agency. How long have you been here? How long have you worked at the health department? And then position history. And the reason I'm asking for the position history, because, and then I'm gonna ask you, the audience, a question, see if you're listening, and I'm gonna have you put it in chat after they're done talking. So go ahead, whoever would like to start. I'll start with who I'm looking at, Jason.
Hey everyone, my name is Jason Sutton. I have been for a little over 4.5 years. I am currently the case management program coordinator. In my time here, I've also been the interim program coordinator for the mental health group home and also the interim coordinator for our crisis care program.
Okay. Nick?
Good afternoon, everybody. Thank you so much for joining us today. I have been here 31 years, so that makes me old. But 31 years has gone by so fast, and I just want to share with you guys, in those 31 years, I've actually held 6 different positions. So way back in 1989, I started as a group home counselor. I worked as a therapist, both in the child side and the adult side. I worked as an assistant coordinator, then a coordinator, and currently my role is as the associate director for behavioral health. So what I can tell you is I've been here 31 years. I wouldn't stay here if I didn't like it. It's really a great place to work. Sometimes people always ask me, why do I stay so long? And the reason is the community. It's the clients, it's the staff, it's working together as one team. And it's just such a great energy. And that's really my story.
Okay, Norma.
Hi, good afternoon, and thank you all for participating in our virtual job fair. My name is Norma Venable, and I oversee our addiction treatment program as the program coordinator. I've been here for a while, not as long as Nick. However, I came in 1998 as a clerk for our mental health outpatient services. And from there, I left, but I returned. Like Nick said, you know, the Lake County Health Department, I love working here. I love what I do. And so I came back to our women's residential services as a counselor, which is our program for substance abuse residential patients. I left that program and I moved into our outpatient substance abuse program. I worked there for about 2.5 years, and then I had an opportunity to move into a leadership position. So I began a position as the ACT team leader for one of our outpatient services where our clients reside in the community. From there, I moved into a program coordinator position where I oversaw our group home as well as our SILA program. And now for the last year, I've been working at the addiction treatment program for our clients that are addressing issues as it relates to substance abuse. So I've been here for a year now. Thank you all.
Okay, thank you, Norma. Dr. Fletcher.
Thank you, Lori. Hello, everyone. I'm Dr. Michael Fletcher. I am one of the associate directors for behavioral health. My degree concentration is in clinical psychology. Throughout my years of training and experience, I've worked in a variety of settings to include community outpatient, psychiatric hospital, residential, forensic, and outpatient centers. I also teach at some of the local colleges and university. So, and that will tell you how much I am a lover of behavioral health and psychology. I began my career at the Lake County Health Department in 2015 as a program coordinator manager for the Integrated Behavioral Health Program. That program is housed in 6 of our 8 medical centers. And it is a program that focuses on providing substance abuse and mental health services to patients of Lake County community that so desperately need those services. But we do that in an integrative fashion with our medical team. 4 years later, after working in that program, I moved into this current position as an associate director. My role as associate director is to provide generally guidance, strategic direction, leadership, and oversight to the associated behavioral programs within the health department. For me, working at the health department is exciting. I live and play in Lake County, and working at the health department gives me an opportunity to also make a difference in my community, in my county. And as a psychologist, I can appreciate our comprehensive services that we offer and our integrative approach. So for me, this is it.
Okay, Elliot Hanna.
Hello, everyone. My name is Elliot Hanna, and I'm the recruiter, actually the only recruiter for Lake County Health Department. I'm probably, even though I'm not young, I'm probably the youngest of tenure. I'll be here in about 2 months, come May, but as far as in recruitment. But I've been in recruitment for about 20 years in healthcare. Tried banking for a while. I didn't like that. Just I wanted the human service field, so I came back to the aspect of being in the medical environment. So, like Lorraine mentioned, now we are doing many different things when it comes to COVID. And when it's something is asked of you, you just jump on it, take it, get it done to support our COVID initiatives. So thank you, and thank you for all coming this afternoon.
Okay, Sandra Gomez.
Hello, everyone. I'm Sandra Gomez. I'm a counselor and I work as a mental health educator and community policy advocate. And I started at Lake County Health Department almost 8 years ago. I started in the trauma treatment program, and then I moved to work for early intervention as a social emotional consultant. Then I moved to my current position. And one of the interesting things when I started to work 8 years in Lake County, when I started to talk with my coworkers and ask how long they has been there working, it was surprising for me that most of the people had years and years working there. And now I understand why. So I have 8 years working here and hopefully have many more.
Great, thank you, Sandra. Valerie.
Hi, everyone. My name is Valerie Meyer. I'm the residential nurse coordinator at Women's Residential Services, also known as WRS. I have been the nurse coordinator since the end of 2012, and I started with Lake County Health Department in 2011 as a flex registered nurse.
Great, thank you all. Didn't miss anybody. No, make sure I didn't miss anybody. Well, I've been here 32 years. So I know Nick said he's old, but I'm not old. I've been in 4 positions. I started in human resources and more of a personnel technician role. Then I moved on to behavioral health services under a grant for a couple of years. And when that grant ended, luckily, my current boss now had left the HR manager role. So I applied for that and was promoted. And then I was promoted into the HR director role. So my question for you all, if you can put in chat, what are 2 common themes that you heard from everyone, a majority of people? Two common themes. Okay,
All right.
let's see
I have a
here.
couple there. Go ahead, Lorraine.
Great place to work and great people. Everyone loving to work for Lake County. Great place to work and love serving. I hear that there's longevity within the company as well as lots of chances for growth. That's what the 2 I was looking for. But the other ones are great. They have worked different backgrounds and they have tenure in the department. It's a great place to work. So yes, you will hear that throughout. Thank you all for participating in that. So now let's get into some of the questions. Wilson, if you could put the slide back up with the behavioral health programs. And our next question will be, if you could provide a brief description of the program and the available positions that are under your leadership. So this question is for the coordinators and associate directors.
Hi, my name is Norma, and to give a brief description of my program, it is a residential program, co-ed, so we provide services for both male and female clients. We have a stay up to 28 days, and this is based clinically on the client's need for services. We receive a lot of our referrals from the community, from within our own organization, from our outpatient services for mental health, or from our substance abuse outpatient services. We also receive our referrals from the jail as well. Our clients receive case management here, where we work with them to assist them with housing, with medical issues they may have, trying to secure employment. We do individual counseling, we do group counseling. So our clients are experiencing and spending a lot of time getting educated and gathering information on how they can remain clean and sober once they leave the treatment facility. We also have a medical provider on staff, as well as a psychiatrist. So if a client is in need of psychiatric services, they can meet with our psychiatrist while they're here in treatment. We also work with the outpatient services for mental health. So when the client leaves, we can set them up for mental health services, as well as outpatient services for substance abuse once the client leaves. We have staff counselors on duty 24 hours. We have nurses that are on duty 24 hours. We have an aide that's a part of our team. We have a program assistants, as well as 2 clerks. So everybody kind of works together here to accommodate the client's needs. We have visitations when we're not up under the COVID. Clients could have visitations here, as well as individual sessions. So we also try to make sure that we include the family in their treatment here, because we understand that addiction is a family disease. So our counselors work closely with the client's families to make sure that they are a part of the treatment of that client if they choose to do so. The open positions that we have now are the flex nurses and part-time second shift nurse, and then we have the flex aid positions as well. So that would be a description and open positions for the addiction treatment program. Thank you.
Thank you. Dr. Fletcher.
Thank you, Lorraine. So I'd like to start with our crisis care program. Our crisis care program houses 4 distinct programs within that one program. It is firstly, we have a 24-hour residential facility for people in crisis. It's short-term. It's about stabilization, it's about treating, and then re-entry into the community. We deal with anything from psychosocial stresses to mental health diagnosis to suicidology. The second program within that is, again, a 24-hour call center that is a brief intervention. It's primarily telephonic, but it's 24 hours, and we're available to manage any crisis situation that a resident within the county has. So we have a call center. We have actually 2 call centers. One is primarily focusing on suicide prevention, and that is part of the National Call Center for Suicide Prevention. And then the 4th one within that particular program is a jail diversion program. And the aim is to save lives and to prevent overdose through substance misuse. That particular program, we're proud to say that we partner greatly with a number of community partners, from law enforcement to treatment providers to interest groups that are looking to eradicate and to solve some of the opiate and substance epidemic or addictions. So we're excited about that. Again, 24 hours, we're going to be right there for our residents and patients, supporting them every minute of the day, either in person or over the phone. The other programs, and oh, by the way, I would hasten to say, we are looking for a manager that can manage all these programs within the crisis care program. The individuals that we're looking for, I'm hoping will have and display a strong leadership ability, one that can inspire, share vision, and encourage people to act. So we're looking for that individual, and we can talk more about that particular person and some of the qualities as we go through. But I also want to talk a little bit about our outpatient mental health programs and our integrated behavioral health programs. These programs primarily focus on offering behavioral health services, whether it's in the form of psychotherapy, counseling, or psychiatry. And all these programs, and you will hear this as a common theme, is integrated with other services of the health department, like primary care, dentistry, case management, and so on. So, but we are looking for therapists, dual diagnosed therapists, or mental health therapists. And these individuals primarily focus on assessment and treatment of primarily severe mental ill population. A day in the life of a therapist focuses on assessment from a biopsychosocial framework, a lot of therapy from a cognitive behavioral, from using motivational interviewing to integrative approach. The essence of our approach, though, is that it is patient-centered. And so we encourage therapist preference in terms of their orientation to treatment, just as long as it's evidence-based. And so we're looking for people who are qualified to be able to fill those roles and to be able to provide some of those treatment options to our residents.
Great, thank you so much, Dr. Fletch. Nick.
Absolutely.
All right, Lorraine, I'll give a brief overview and I don't know if anybody wants to add as I go along, but Children and Adolescent Behavioral Services is probably our largest outpatient service. I think we have about 40 staff. We have counselors, therapists, psychiatrists, nurses, coordinators, medical assistants. I'm always afraid I'm going to forget somebody, but I think that covers it. I think a way you can look at children's services is we probably have about 8 different programs under CABS. But if you look at, you can probably break it out into crisis work versus kind of long-term work. So we do a lot of work centered around crisis assessments. We provide crisis assessments for children and adolescents who are suffering from either behavioral issues, psychosis, and we'll go out and do crisis assessments 24 hours a day, every day of the year. And we typically average anywhere from about 150 to 200 crisis assessments per month. So it's an extremely busy program. And then we usually provide crisis services for about 90 days, and then those clients will funnel into our long-term programs. In our longer-term programs, we really are focused on trauma. We do a lot of evidence-based trauma work, long-term case management if needed. So there seems to be openings, because we're such a large program, that there's always seems to be an opening for a counselor or a therapist in CABS. And really what we're looking for is people who are, first and foremost, really passionate and want to do community behavioral health, right? Who really want to serve the community. As an associate director, I think one of my biggest directives to everybody is everything we have to do is client-centered, right? We're not here to serve ourselves. We're here to serve the community and the clients. But you'll see a lot of periodically, if you check the board, you'll see openings in CABS for counselors and therapists. It's probably the biggest need in that program. Lorraine, you want me to keep going through some of the other ones?
If your managers aren't there for the programs.
I'll let Jason cover CSS, and then I'll add in anything that's needed.
Okay, go ahead, Jason.
For the community support services programs, again, I'm the coordinator for the case management program. Under the case management program, we have 4 distinct programs. We have our, what I would call just our regular case management, where we provide services to clients in the community who are diagnosed with a serious mental illness. And the goal is to provide supportive services to help them maintain independent living so they don't, someone doesn't have to go to a higher level of care, such as like a nursing home or another residential facility. Another program we have is therapeutic intensive monitoring case management. And that is, it's a specifically one case manager who works with our mental health court and drug court programs, again, providing case management services, but they're specifically involved in those 2 court programs. We also have a COAST program. It's a Crisis Outreach and Support Team. And that is a collaboration with the Lake County Sheriff's Office, where we receive notification from sheriff deputies for individuals they've encountered on 911 calls who are perceived to be under a mental health crisis. And so they refer them to a case manager to do a follow-up call to see if they need any type of resources or community access, whether it's mental health treatment, housing, food pantries, things of that nature. And then our newest program, it's our Transitional Community and Care Supports Grant that we received. And that is providing short-term case management to clients who are being discharged from state-operated psychiatric hospitals. Specifically, we're working with Elgin and Madden to provide up to 90 days worth of case management for those individuals to help them reintegrate into the community after they're discharged. Under community support services, it also, there's quite a few programs that fall under that. There's a couple, there's some housing programs, specifically our clustered and scattered apartment programs are under there. And we have a Zion apartment program as well, and our mental health group home.
Okay, great. Valerie.
Okay, I'm going to talk about Women's Residential Services, WRS. It is very similar to what Norma described for Addictions Treatment Program, ATP, except, big surprise, we only take women. So we take women over the age of 18 that have a primary diagnosis of substance use disorders. Many of them also have co-occurring disorders, so it's not uncommon that they also have mental health diagnosis as well. Our programming and length of stay is very similar to ATP. We do have also evidence-based curriculums, and with the women, we tend to focus on more trauma treatments. We'll work on women's health. We do some parenting classes. We'll set up with DCFS if they're involved with that. And same thing, we have a medical doctor that's here to see them and a psychiatrist as well. And the positions that we have open is a flex registered nurse, a part-time PM nurse, and we have an aide, and then hot off the presses, I think we're going to have a overnight counselor position open as well.
Okay, thank you. So now some of you already went through what some of the characteristics are of an ideal candidate, but if there's any of you that would like to speak on that, or we can pass if you've all covered it. Okay, let's go on to the next one. So I think most of you covered that. Now I would like for, we'll start with Sandra on this one. Describe a typical day for a counselor role. So the audience can know, what is it like to be a counselor? And she's currently in the CABS program. Go ahead.
So depends on the program, is some particular activities, but in my program, we have several counselor positions with different responsibilities. Overall, the counselors are able to manage their own schedule with clients. We work with kids from 3 to 20 years old, provided individual and group therapy, also provide case management and crisis intervention. The counselor will have a caseload of approximately 25 clients a weekly. Clients I primarily see in the community, at school, at home, as well as in the office. Right now with the COVID, we are providing telehealth. So some clients see clients, some therapists see clients in the office, but mostly we are providing counseling services from home. From some positions, there is crisis on-call responsibilities. Like you hear before, the crisis services is 24/7 throughout the year. So some of those positions required be available in the nights as well. That's all.
Sandra, what is an example of something if you get called for in the night? What is an example without using names or anything? You know, what's a type of situation?
Yeah, in particular, our program is for children and youth. Can be that youth is thinking to end his life. Mom doesn't know what to do. Mom thinks he's in risk situation, and they can call the crisis line program, and they contact us, and we have a few hours to arrive home or have contact by phone by the client, depends on the situation. The counselor identified what is the needs. The counselor can say, bring the client to the closest emergency room, and the therapist will do the evaluation there, or the counselor arrive to the client's home and do the evaluation at home. When the counselor is with the client, the first thing that we do is de-escalation and identify if the client is able to stay at home safe. And like Nick said in the beginning, that client will start a program with us for 90 days. That is the crisis program, just to be sure the client is stable. If during the evaluation we identify the client is in high risk, we recommend to refer to a psychiatric hospital, and we do all the process with the family. So we will be with the client and the family throughout the process until be sure the client is in the hospital and is safe. We continue monitoring the client throughout the time that he is in the psychiatric hospital and after the discharge for 90 days. After that, we can continue with a long-term therapy services for the client, or we refer to the community, depends on the needs of the client.
Great,
I don't know
thank
if
you.
that was clear?
Yes, very clear. Did you hear all those organizational values in there, teamwork and professional competence? I mean, she just went through all of that. I mean, you can just hear it. So when you have the values, it's not about just having a word, it's just we have to act on that. You have the crisis care and the CABs working together. Jason, can you tell us about the role of a counselor from your perspective?
Sure. So in case management, kind of a typical day for one of our case managers would be, we could be helping someone apply for medical benefits or apply for housing if they're homeless, getting them connected with PADS, the Homeless Resource Program for Lake County. We could be assisting them with picking up their medications from the pharmacy to make sure that their mental health is remaining stable. We could be helping them work on their coping skills, helping them create a budget, pay their bills, kind of a wide range of activities. I'd say no day is the same, or no 2 days are the same as things come up. Everyone is always prepared as, the day may change. They might have their schedule laid out from 8 to 4, but as things come up with different clients, they, one appointment may take longer, so they have to adjust and work with that client on whatever their situation is they're working with them on that's taking longer than expected, call their other clients and kind of move their appointments around a little bit so they can still see their clients, but just let them know they might be a little bit behind schedule for that day. So really, it does kind of change. We also work well with I would say the crisis care program. We make sure that clients have that number in case, if there is a crisis after hours or on the weekends, that they do have a resource to reach out to, which is a great resource we have because it's a 24-hour number for them to reach out to and call if needed. So I say that would be a typical day.
What is an average caseload for a weekday, whichever one you want to talk about?
Yeah, that can, as far as a day, that might vary depending on what the client appointments are. As a whole, a case manager caseload could be anywhere right now, averages like 20 to 23 clients. And the reason why it's that number is usually the case manager will meet with each client about an hour a week on average to provide some kind of supportive service to them. So if the caseload is if it was increasing and it went up higher, then not everybody could be seen every week. So we try to keep it within a manageable number so that clients can get the services they need.
Okay, thank you, Jason. Valerie, can you, the same questions, describe a typical day for a registered nurse?
Okay, I'm gonna actually talk about it in like 2 different roles too, to kind of address all of the openings that we have in behavioral health with nurses.
Okay.
ATP and WRS are both considered inpatient programs. So those job descriptions are pretty similar, and those days would be pretty similar. Your caseload would be anywhere from like a range from 8 to 16 at women's residential. It kind of depends if we're operating at full capacity. Same thing for ATP, operating at full capacity. It could be anywhere from 8 to 12 like clients that you would be dealing with. Typically, there's medication administration is a big one for inpatient. There's a lot of med pass. It could be injections. It's mostly oral medication. It's a lot of education on the meds. There's a lot of clients that get started on medications while they're with us. So you're educating them about their medication or watching for any side effects. We do a lot of vitals on site. Currently in this COVID times, we're doing more testing, as you can imagine. We do some blood draws as well. There's a lot of coordination of care with the medical doctor or the psychiatrist. They really rely on the nurses to evaluate and see how the client has been doing. There's a lot of med management or adjustment, and that's on the nurse as well to update. We have a medication administration record. We'll update in our EHR as well. There's also coordination with pharmacy that we have on site at the health department. Depending on the day, you could have an admission or a discharge or both. There's also working as a team, like Lorraine had said earlier, all the time you're working with other therapists or counselors or the program coordinators to assess that clients and their readiness for change and things like that. Currently on the website, we have some nurses that are posted and it says CCP, ATP, so that would be inpatient. WRS has some openings, and then there is an opening for a CABS nurse. Nick and Sandra did a good job describing kind of how the CABS program is. I'd say, so same thing, they could have a typical caseload of up to 25. It just kind of depends on the day, and it depends if it's crisis or long-term care. But they would do more things with like the pharmacy. They might do more prior authorizations. A lot of time the nurses will assist the doctors with prior authorizations because there's a lot of medication that might not be covered, especially under a Medicaid plan. And so the nurse is really responsible for getting that medication pushed forward with insurance to see if they can't get it covered, and getting it sent to pharmacy and working with the families on educating them about the medications as well. So yeah, that kind of sums up for nurses all over behavioral health.
Great, thank you. Great job. Sandra, how would you describe the work environment in CABS?
So in my program and as a Lake County Health Department as a whole, I have an inclusive, friendly, supported environment. My supervisor allowed me to work independently and support my ideas. And that's important for me because I always say that my work is not my work, it's my passion. And it's important for me to feel like I can project my ideas and my passion in every single day in my job. So that allowed me to use all my potential and be connected with my passion, that is serve the community throughout therapy services and education.
Great, thank you. This one is for coordinators. How would you describe the team dynamics in your departments? Norma, we'll start with you. Been quiet.
Okay, so our team works together. We don't have the environment where that's not my job. someone else can do that, or individuals leaving things undone as relates to the clients and the work that we do here. I'm a part of the team. So I am not sitting behind my desk on a computer. I'm out there with my team. So I facilitate groups. I jump in when they're not available. They jump in to help each other as needed. You know, and Lorraine kind of talked about the statement of organizational values, and that was one of the things that my team wanted to do. They wanted to develop their statement of the program values. So we worked as a team and we identified those areas of value when we talk about the outstanding customer service, the outstanding teamwork, the outstanding professional competence, and the outstanding fiscal responsibility, you know, and doing that team building exercise was really good for our program because it allowed everyone to participate in identifying those different roles that they play and how they are appropriate or they fit into our values, you know. So I appreciate my team. I love my team. You know, when I got here a year ago, I used to hear from my office, a lot of my staff are communicating with one another, you know, like, hey, can you do this? Or, hey, can you take this client to this appointment? Or they would just communicate via email, you know, making everybody aware. And that was one of the things that I was really appreciative of when I came here, because the team had already been developed before I came. So, yeah, I have a great team over here at ATP. Looking for some more individuals to participate and be a part of the team.
Great. How about you, Jason?
I would say as far as team dynamics or teamwork, it's in case management, it's amazing. We have 3 case managers who have been at the health department many years. There's 2 that have been here over 30 years and are great mentors for the newer staff. They're also, as far as a team as a whole, they're great about sharing resources with each other, saying, you know, hey, this resource is no longer available, but maybe here's a new resource. Or for example, like energy assistance is now available for people to apply for. Here's the paperwork. So really sharing those resources within the team to make sure that everyone has the most up-to-date information to help their patients and clients. You know, because in case management, it can be a little independent, or it's a lot of independent work because you're out in the community with your client one-on-one. And so it's about to come back to the office and then be able to meet with or talk to another teammate and review resources, even have a case consultation about, hey, this was a challenging situation today. Here's what I did. How would you have handled it differently? Or just to get some feedback. You know, if I'm not available, or if they are, you know, they like to talk to a case manager instead. I just think it's the case manager team is amazing.
Great. Thank you. Valerie?
I would echo everything everybody said. We really take an interdisciplinary approach. So the professional opinions of all the staff are really included when we talk about our clients. It's very client focused. We have shift report 3 times a day. We have weekly team meetings. So very much a team approach.
Okay, now let's, what expectations, this is for Nick, what expectations from you as an associate director for your management team? What are the expectations?
I would say my list, I probably have a list of like 8 to 10 that I always kind of talk about. And I talked about a couple already. The first one is to be client-centered, right? First and foremost, we're here to serve the community.
Mm-hmm.
Secondly, as a leader, you know, my expectation is that you put your staff before yourself, right? It's the old adage, if you have great staff, you're going to look good. So you don't have to make yourself look good, right? Your staff can make you look good. But we look for effective communicators, you know, definitely a positive attitude. We want our leaders to be mentors and teachers. We want them to create a safe and healthy workspace. Provide strong leadership and a clear view and a clear vision so people can be successful. And to be accountable, right? And I think Norma touched on that too. And hopefully I rubbed off on Norma a little bit, is don't be afraid to get your hands dirty, right? You know, as a leader, you have to be willing to do things that your staff are willing to do. So there are some of the qualities that, that I expect from people when they become leaders at the health department.
All right, thank you. Dr. Fletcher.
So I just quickly to add to what Nick has said, because I too embrace all of those for my managers and leaders. But one of the things that I want to kind of underscore, Lorraine, and as you know, the work environment that we have and work in really depend on us, not just managers and leaders, but everyone who works with the health department to really have integrity, because we have an unwavering commitment to ethical standards and practice that we have to adhere to. And so people would have to have an affinity to be, to have a high level of integrity. And we look for that. And we find that in our leaders, and we celebrate that day in, day out. We do the right things even when people are not looking, because life depends on it. I mean, all of the panelists talk in some ways about the struggles that our patients and clients have. And some of those struggles, go all the way up to suicidal ideation and attempts. And people rely on us to be there. And so integrity is a big one. Open to feedback is a huge one. And that ties into, an affinity for growth and development. And managers and leaders need to be open to that so that they too can continue to develop the workforce. And I think that's the piece that we look for a great deal. This is a fast-paced environment. We're always learning things. And so I personally look for remarkable rates of learning from, the individuals who are in leadership. As Nick rightly say, someone who can inspire, share vision, model the way, and encourage people to act. And most importantly, challenge their own process as a leader. I think those are some of the values that we embrace.
Very well said, both of you. Thank you. Okay, our next question is for Jason. We have a slide here of some of our growth opportunities. Within the health department, there's many tiers. We're focusing on behavioral health because that's why we're here today. But there may be finance tiers, there may be administrative, clerical type tiers where there's opportunity for growth. And many of the growth opportunities, not just if you get a degree, you advance to a higher level position. It's developing yourself to obtain that degree and positioning yourself to be prepared if there's another vacancy within the health department. So as you heard from all the panelists, they're here. If they see a position posted, you know what, I have the skill set to do that. I want to move up. So it's a great idea for employees to look at the job postings that we have and see what type of requirements there are, because then that helps them to set their goals for their performance a year and decide, what, eventually I want to be a therapist or I want to be a counselor 3. What do I need to do to get there? You can't sit back and wait for it to just happen for you. You have to do something to get there. But then you're prepared when there is a job opening. So Jason, if you can kind of talk about what are some of the typical growth opportunities within the counselor role?
Sure, thank you. So as Lorraine said, this slide kind of just gives a brief overview of the different levels of positions and some of the education requirements or licensure requirements. So I can really talk from the case management perspective and how this is growth opportunities have helped case managers move on to other positions in different departments. So in case management, most of the case managers will come in as a counselor too. So they might have a bachelor's degree in like counseling or psychology, or and then maybe a bachelor's degree in maybe criminal justice, but they've got the 2 years of experience in mental health, so it meets the criteria for us to hire them for a counselor too for case management. And then someone may go back to school and get a master's degree in social work and become an LSW or LCSW, obtain that full licensure. So then that opens up the door for more opportunities within behavioral health. So, in our outpatient mental health programs or our primary care behavioral health program, is there a therapist position open that they would that's the individual would qualify for now based on their master's and their license, and experience, and then so they would apply for that and then maybe transition to that other program. In case management, we talk about it's really like an entry level into behavioral health because it's really great experience to come in with a bachelor's degree, get that experience for a couple years. Again, maybe someone does go to a master's program and obtains that master's degree, and then moves on to, as Nick had mentioned, like our child and adolescent behavioral services program, or someone's really interested in substance abuse work, they might move over into that side of behavioral health as well. But I think there are great opportunities. Specifically, since I've been in case management, I've had 4 case managers. 2 were able to get a master's and then obtain a license, and so they moved on to a therapist position in outpatient mental health. And then I've had 2 case managers who have they were in case management enough to get the next level of experience needed for the Counselor 3 role, and so they transitioned in to be a Counselor 3 in the CABS program. Which great. I mean, I'm always supportive if they're getting that experience and wanting to stay at the health department and move on to another program. I think that's really great.
And then, yeah, you hit the nail on the head. Our managers are very supportive. Always hate to lose your staff, especially the well-trained staff, but we know that it's better. Either you lose them within the agency or you're going to lose them outside of the agency. So we very much support people moving throughout. We do have tuition reimbursement for employees that are looking for higher education after you've been here employed for a year, and that's like $1,500 for employees that are studying higher level education. Let's see, is there anyone else that would like to answer that question? Within your areas, what type of growth you've seen within your programs of people moving up into roles? I think it's pretty much the same. Okay. If you could describe the opportunities you have participated, such as employee committees, leadership roles, external boards, or partnerships to further your development. Val and Sandra, I know you have some to say about that if you want to jump in, either one.
I can go first. I've been involved with a lot of different committees, which have been great, kind of a great change in my day as well. So I've been on the HealthWorks committee, which is an employee committee trying to promote health at each location. Like Lorraine had showed that slide with all the locations. So everybody had like a HealthWorks representative, and we would promote health there and promote whatever campaign was happening. If it was trying to increase your number of steps or drink more water. So that's been fun. I'm also on the behavioral health nursing committee, where the nurses from all the different programs kind of come together once a month and talk about any issues at the programs and also review policies related to medical. I'm on the infection control committee as the behavioral health representative. So that's been interesting in light of what's been going on. I was also on the committee, that one slide that talked about our history when we were public health accredited back in 2015. I was on the committee to help get us accredited for that. Again, interesting in the times. I was trained as a site manager through emergency management back in the day when we were worried about avian flu or anthrax. So now it's COVID. I've also, before I was a nurse, I got my CADC, which is Certified Alcohol and Drug Counselor. And I still maintain that certification. So I'm able to precept a counselor intern, which is also nice for my experience. Like I said, it kind of helps break up my day and gives me something else to look forward to.
And from my experience, because I'm very active and I like to explore different things in the agency, I also have been participated in the past and the Health Work Committee and Green Team. Also, I support activities by the Diversity and Inclusion Committee and LGBTQ agency event. Currently, I'm one of the safety officers in the agency, and I'm part of the social committee in my program. So, and I love that because in my own program, we have this social committee when we get together and plan different activities for us, like birthdays or special events for us. And I think that is important to have those spaces, just not to focus on work, but also how can we improve our environment daily there. And I think having all these teams available for us to participate is what make the environment so friendly and healthy inside the Lake County Health Department.
Thank you very much. All right, let's move on to a few recruitment questions. Elliot, you know, I see on the posting related field, behavioral health and related field. What does that mean when I see that term?
Okay, well, actually, it is a broad term, related field. You may see bachelor's degree, as Lorraine mentioned, in that field. But what does it mean? Because there are many degrees that's related to the behavioral concept of dealing with human behavior or social services. So for example, you may have a degree in sociology, social work, drug, alcohol counselor, criminal justice, as Jason mentioned, and some of the others mentioned about marriage or family therapist. So the list can go on and on. So it's very broad. So when you see that, if your skill set match that and you have those degrees, then it's possible you can be a really good fit for a role.
Great, thank you. What recruitment advice would you give to candidates that desire to work for the Lake County Health Department? They've heard all of the wonderful stories from the panelists and how they love it here and how long they've been here. What advice from a recruitment perspective?
Well, that's another good question. Basically, I would recommend having a very detailed resume that clearly highlights your behavioral health or human service experience. Make sure that you include your license number. Now, why do I say that when it comes to credentials? Because sometimes your name may be different on your resume than it is when I look up the license. So if I have the license and number, it'll make it much more easy for me. And I like when things are made easy for me when I'm recruiting. And you want to make things easy for me while I'm recruiting so that I can help you along when it comes to a position. And also, I think it's really key when it comes to speaking to your passion and your career choice, in addition to when it comes to your knowledge and your skills and your abilities. And the reason why I say that is because the first role that I had when I came out of college, my degree was also in psychology. And I asked the manager about 10 years later, I was a counselor at Vista for about 12 years. And I asked her, why did you hire me? She said, because you spoke with passion. You're really connected with what I want to see. And I saw that you cared about people and you don't mistreat people. So when you speak to the managers, which you've seen them all, so when and if you're considered, you've actually seen the managers and how they speak about the passion of their career. So that's one good example that I'll give you all to really speak to the passion of your career.
And I would add one more is to really review, because there's plenty of information in the job postings, really review that posting, make sure that job is for you, because then you can, if you get the position, you will have the passion, but to just try to jump in a position to get your foot in the door, that's not a good approach. Review the position, research the company. Many times we're doing screening interviews, and that's a very basic thing. You ask that question, what do you know about Lake County Health Department? And they really don't know anything, but there's a wealth of information on our website. Take time and review that, and it's broken up by all of the behavioral health and different programs. Learn about that program you're applying for, very important. Okay, one more. What is the difference between full-time, part-time, flex on the postings? You'll have FT, PT, and flex. What is flex?
Full-time is for employees who work 37.5 hours a week in an hourly position. Part-time is anything less than 37.5 hours a week. Now, as far as full-time, as an exempt employee, that would be 40 hours a week. So then we hear the word flex, as Lorraine mentioned. Flex, you may have heard this, PRN, per diem, as needed. That's what flex means when you see that on our job posting.
Okay, thank you. Now this is for the coordinators. What impact has your program made in the lives of the Lake County community? And let's start with Nick. He looks like he's ready to answer.
I wasn't expecting that, Lorraine. The impact programs have made, I'll let people talk about specific impacts to their programs, but when I think of this question, I think when I started in 1989, our behavioral health staff was maybe 75 to 100 people. and now we're close to 300. So the amount of programs that we've been able to develop and the extent of the programs we develop, and we were behavioral health, we have substance use. It's quite amazing. I don't think you're going to find another agency in the area that does as much as we do. And for employees, like we've been talking about, it's such a great opportunity because you'll have so many chances to do multiple things. You know, like I said, I was here 31 years, but it's like I've had 6 different jobs during those 31 years. So I think just how we've been able to expand and provide services to the community is one of the things I'm most proud of.
Good. Okay. Dr.
Lorraine,
Fletcher?
yeah, thank you. So as I've said before, I think the biggest thing for me when I think about some of the programs that I oversee is the fact that we are saving lives. I mean, the suicide rate is going up all over the country, and sometimes we don't necessarily count the lives we save, but have to be honest and tell you, sometimes just simple intervention with someone who has suicidal ideation, and you help them to prevent an actual suicide is what some of these programs are doing. You know, it's, as you asked some of these questions, and I am reflecting, to be honest with you, it's one of the reasons I am so proud to be an employee, you know, a part of the health department, because when you think about the impact, not just by program, but as an agency, one of the things that I recall, and this piece sticks with me for a long period of time, right? Because in 2019, for example, the BAH expanded its services. And one of the things that we did to meet the needs of the community is that we identify and certify 55 volunteer mental health first aid instructors who in turn train about 750 community members to be a difference maker in our community. And I have to tell you, those individuals worked within the community to make about over 1,300 referrals, connecting people in our community to mental health and substance abuse needs, treatment services. And Lorraine, my day haven't even started yet, right? When based on my own individual work and input. And so that's the kind of impact just as an agency, and it makes me proud. My point is, while we are helping the community, we are also helping the staff within the agency as well, right? It's a place where someone can come and make a difference, can find themselves, and can experience a satisfying career. So we are saving lives both in and outside of the agency.
Yes, most definitely. Thank you. Valerie?
Yes, I mean, to be qualified to be at the program that I'm at, Women's Residential Services, I mean, you have to have a severe substance use disorder. So these women are very much in need of help. And so same thing like Dr. Fletcher was saying, we're definitely saving lives. I think we're increasing access to mental health services and reducing substance use overall. But something, I do have a statistic that our program is pretty proud of. One of the ways that they measure success kind of on a national level is looking at how many people complete the program, how many people actually complete treatment. And SAMHSA reports that nationally, for a program like WRS, the completion rate's about 54.3%. And at WRS, we have always operated above that. And most recently, our statistic is our completion rate is 75.1%. So we have majority of our clients that complete treatment. And that just means that they are not being hospitalized again. They're not being rearrested and going back into the jail system. So that's something we're really proud of.
That's wonderful. Thank you. Jason?
You know, I've been thinking about this question for a couple of days now. You know, in case management, it's really hard to say, you know, we're reducing like a statistic necessarily that we're improving. For me, and I think for the case managers, it's really about the impact on the individual's self-worth or self-esteem. You know, helping someone get connected to a food pantry so they can put food on the table for their family, helping them obtain housing. So, someone's been homeless for 10 years and we help them get an apartment. I mean, those things are huge. While it's maybe, just a small number of people we can work with at a time, but over the course of years and years and years, I think that will have does have a larger impact.
Right, Norma.
Hi. So, I mean, everybody kind of spoke to it, but just to kind of elaborate on the impact, I think, since even being here at the addiction treatment program, just the reduction in the recidivism with our clients. A lot of clients say they're going to come back, and see you. And after they've been clean for a period of time, a lot of times you don't see that, but it's happening. Clients are coming back, participating in our alumni panel, which we have here at Addiction Treatment Program. And even when I look at some of those clients that are participating in the panel, they've been clean for 5 and 6 years, and they still come back to support the program and support the individuals that are participating in it. So just the fact that we are, the biggest impact is just being able to provide the services for the clients that need residential treatment. A lot of clients can maintain at a level of care in outpatient services, but then you get those clients that really, really need to be in a safe environment. And programs like the Addiction Treatment Program and Women's Residential Service are key, and they're really important to our community to make sure that we're able to provide those services when those clients come and knock on our door and need those.
Good, thank you. Sandra, on the same vein, if you could describe the impact you have made in someone's life while working at the Lake County Health Department, and what was the result of your actions? If you want to give an example, that's fine, or however you'd like to answer.
Thank you. So during these years working here, has been the privilege to impact thousands of people's life as a counselor or as a mental health educator. So I love to work in the macro level, and that allowed me to participate in interdisciplinary and cross-sector collaboration, generated a positive impact in the county level. That is my community. And I want to remark the amazing work we have been doing during the pandemic. So Lake County Health Department has been reaching out the community agencies throughout the county and organize different groups to work as a team for the community. And I think the county has been doing a great job during this pandemic. It's just because we know that we work with other agencies. And in particular for me, that is important. I like the macro level work, and I'm able to do that job here.
Great, thank you. All right. What precautions are in place to protect employees from COVID-19? We can't get away from a question that, dealing with COVID-19. So, Elliot, if you could speak on as far as when people enter the building and our orientation, how that's changed. And then coordinators, if you can describe operations in your program at the present time and then prior to COVID-19, what changes have been made to ensure employee safety? Elliot?
Sure. Well, first of all, you are introduced to a very happy, energetic person at the front door. You can't see her smile physically because she has a mask on, but you know she's smiling underneath. I mean, she is chipper every time I come in the building. So you'll be greeted that way. You yourself must have a face covering on, and you'll be asked a series of questions to make sure that you are not meeting yes to some of those that can potentially put you and others at risk. Then you'll be submitted to a non-contact temperature check, where they put it up to your head or your ear or your wrist. I think I had them in all places, so forth, and she'll check your temperature. And then you'll be provided some hand sanitizer to keep your hands clean. Now, as far as orientation, we have a limited number of people that we can bring into one room when it comes to orientation. But everyone is still expected to wear a mask covering, as well as keep 6 feet of social distancing. So we're real big on that. Even when we have our meetings, when I'm in the office with staff, we are spread all over the place. We make sure that we keep that in place because that's a safety precaution. And as far as other meetings like we're having now, outside of work. We have virtual meetings where staff can be online as we are setting everyone coming in, because once again, that would increase the risk. So we don't do that. And as far as being in the office, it's very limited. I'll go in on Tuesdays, and every, I think, 4th or 5th Friday, I'll go in. And once again, we do all of that to make sure that we are practicing social distancing, wearing our mask, and keeping everyone safe. So it's a nice, well practice that we have in the county. And we have to be an example to that if we're going to take the lead in the community.
Okay, thank you. And so I know we're getting close to time. Norma, if you can talk on the perspective of residential programs, what are you doing different? And then someone else can speak on whether Dr. Fletcher or someone speak on the therapist and that type.
Sure. So what we're doing is basically making sure that we keep both our staff and our clients safe. And so we're doing so with being in a residential program. When our clients are scheduled for an admission, we do a screening. So the nurse calls the client 24 hours to admission, and the client is screened for COVID symptoms. From there, the client is brought into the treatment center. However, we do an instant COVID testing. If that one comes back negative, then we'll admit the client, and then the client can then receive the PCR testing, which we wait for the 48-hour results to come back. The client is isolated in the room until we get the results, because we want to make sure that we have a negative results before our staff are making direct contact. But meanwhile, our staff are in full PPE, the goggles, face masks, shields, gloves, gowns, and everything. We've also put in Zoom. So right now we have computers in our client's room. We didn't have computers prior to now, so that we can still be able to provide the services to the clients. We wanted to be able to do so and do them via Zoom, so that way the clients could continue to receive treatment while they wait until the COVID test comes back negative. Our staff we do have counselors that share offices. However, the shifts overlap, so there's no counselor in the same office at the same time. Throughout the building, we wear our face mask. We wear our face mask and our shields or goggles. We maintain social distancing. All of our meetings now are done on Teams. We don't have any in-person meetings where we are sitting within 6 feet of one another. We did a lot of things to accommodate our clients as well, because we wanted to make sure that they were comfortable while they were here. So we have separate meal times for our clients. We also reduced the number of clients that we were taking in. So prior to COVID, we took in 16 clients on our rehab and 6 clients on our detox, which is now known as withdrawal management. And so right now we're not providing service in withdrawal management. As most people know, there's a medical component that takes place when you're working with clients in withdrawal management. So we're just using our rehab part of our program. And with that, we are only taking in 7 clients. So now these clients are not sharing rooms either. They're also in individual rooms. I'm trying to see if I missed anything. And if I did, Val could actually jump in, because one of the things, we kind of talked about the collaboration and the work that we do here at the Lake County Health Department. And Val is the nursing coordinator at the Women's Residential Services. However, in the absence of my nursing coordinator, she's really stepped up to the plate, so she's been a part of the planning as we opened up ATP and then opened up the Women's Residential Services. So if you have anything you want to add to that I may have missed, because I know we're working with time right now, Val.
Yeah,
if not.
You did really good. We just follow state mitigations too for groups and dining, so they're not allowed to dine together. And our staff also, like Elliot had said, gets screened right when they walk in.
Correct. Thank you.
Okay, as far as clients that we visit at home, whether it's Jason or Dr. Fletcher, who can speak on what are we doing? Do clients have phones? Are they able to do the telehealth? What are you doing different there?
As far as for case management, I can speak on that. So, we've changed to a combination of both in-person visits and telehealth. So most of our clients do have a cell phone or still a home phone, a landline. So we do talk to them over the phone or have sessions over the phone. And then if needed, we also do provide services in the community still for them. There are some clients who do not have a phone, so of course then we do have to see them primarily at their home. As far as COVID precautions, similar, staff have to wear a face mask, use a face shield. We have other protective equipment like gowns, gloves, disinfectant wipes and sprays and things like that as needed. Clients, if we're in meeting with a client, they are required to wear a face covering as well and maintain social distance. If we transport a client, they have to sit in the back of our county vehicle, and weather permitting, we roll down the windows a little bit for airflow and things of that nature.
Okay, thank you. There are a couple questions in the queue. One for Elliot. Do you hire people with sealed felony convictions?
That's considered on a one-on-one basis. That's something that I normally consider with the manager of HR as well as my boss, Lorraine. So that's done on a case-by-case basis. So
What do we
how do
normally
it.
look at in the background check? Well, how many years do we have?
I think 7 years. It's normally as far as we go back when it comes to looking at any type of convictions or misdemeanors, depending on what they are and how it would or would not affect that particular job that you're applying to.
And if it's sealed, we probably won't see it anyway.
Correct.
And again, if it's a DUI and you're not driving for your job, many of our jobs, especially in behavioral health, may drive. But if your job does not require driving, that won't be something we look at. So we kind of look, as he said, a case by case based on the job. This one is for whoever can answer. If I do not have experience in behavioral industries, but have experience in people management leadership, do I qualify for case management positions? So maybe Jason.
I would say it would be back to the slide where we had the different levels of like counselors and therapists. It really I would refer always back to that as far as the type of degree and the years of experience. If someone's interested, I would always say at least submit an application or submit your resume so that it can be reviewed. Because it is, it's for me, it's an individual one-on-one basis to review them separately.
Yeah, because behavioral industries, that could be anything just from this surface of the question. So you really need to, as Jason is saying, see the resume. There's many skills that are transferable that you can use from job to job, but I think seeing the resume would be helpful. So my advice would always be, if you have at least 80% of the job, apply anyway. Then we can at least have an opportunity to see you. Maybe not for that position, but some other position. So if there's other questions, they can come through, but I'm gonna go ahead and move to the next steps. Elliot, if you can, Wilson, if you could prompt the next slide. And then Elliot, if you can tell the candidates, what do they do? We realize that I'll let you go ahead and do that part. If you can just focus on how do you apply on our Silk Road system, you don't have to get all the way into the interviewing part.
Okay, all right. So we see here up top, we go to our website, and then you see to the right there, that arrow where it says all jobs. Click on that. It's a lot easier when you do that, because then it will open up the bottom page. See your far left, you see the next arrow where it says behavioral health. If you click on that, it will only open up all behavioral health positions. And then to the right, then that's what Lorraine was saying earlier. Make sure you look at those positions and see which one really meet your qualifications. And make sure at the end, you click submit all, because if you don't, it will not come through. So that's a very quick process, and just click here, click there, review it, go through everything and attach your resume. And once again, if the manager is interested, then we'll reach out to you.
And it's my understanding that we will receive a copy of everyone's resume that has registered. So, but you still need to apply online. So you still need to go online and apply, because we're going to have a paper copy. We deal with electronics, so we can track within our record. We're able to add our notes within there if on the various stages of our interviews or screening. So please make sure you apply if you see anything that you're interested in.
Lorraine, if someone submits an application and applies for a certain job, and even though I don't qualify for that job, whoever looks at that resume, will they submit it to somebody else in another department if I qualify for another position, or how would that work? Yeah,
that's a possibility. I've passed along applications that, wow, this position is open. This would be a really good candidate. I'll call the manager, send them their resume, tell them they applied, and if they're interested, then the candidate can either apply to that position or I'll port them over to that particular job, and then the manager can proceed from there. So the answer is yes.
So there's a question online. I have my bachelor's of arts in psychology, but I don't have experience in behavioral health. Would my degree be taken into consideration? Most definitely. For our counselor roles, the one slide on page 11, I believe it was, well, I printed mine. So look at the slides and you'll see the various growth opportunities. There are positions that are just associate's degree. So by all means, if you have a bachelor's of arts degree, then you would qualify for some of our positions. But again, it's very important to look through the postings and read them. Another thing that people with Bachelor of Arts, they may have a job somewhere else and they see a flex position that's opening, flex counselor. That's a role where you could be called in when people are out sick or on a leave of absence and they need somebody to just cover for 2 weeks. So now that's an opportunity for you to get your foot in the door to be a flex counselor. We've had many people that have started as interns or flex counselors and they've moved up the ladder. Dr. Fletcher and Nick's supervisor, who's Sam Johnson, who's a director, he started here as an intern. He's gone through various positions as well, and now he's the director of behavioral health. So it definitely, is an opportunity for you as well. And so I'm concluding my time. I really want to thank you all for joining us today. Jeff, I don't know if you have any closing words, and I wish you all good luck.
I just want to say thanks to everyone. Presenters, you guys did a great job. Thanks for everyone that attended today. A copy of the PowerPoint presentation will be sent to everyone that pre-registered. So if you have additional questions, you'll be able to see the contact information for us and we can relay those questions to the health department. Otherwise, go to their website and apply for the position and have a wonderful day. And thank you very much, everyone. Thank you.